I don't know if this has been your experience, but I find a lot of private practice owners shy away from leading their team. They will not have team meetings. They will not cast vision. They will not hold anybody accountable. And even the biller can do whatever they want as long as whatever you did is enough to pay the bills and pay the team. We don't have to have a conversation.
Welcome to the Physician Growth Accelerator podcast. I'm your host, Zed Williamson, and today we have a very special guest, Dr. Una. She is a pediatrician, a serial entrepreneur, and she has a passion to help physicians create the freedom to live life and practice medicine on their terms. Dr. Una, thank you so much for joining us today.
Thank you so much for having me. I'm super excited to be here.
Yeah, so tell us, just to get started, just so people have a foundational understanding of where you're coming from. You're a pediatrician and a serial entrepreneur. So how do those things come together and how did we get to where we are today?
Yeah, so I completed my training as a pediatrician in 2008, and I did what I was quote unquote supposed to do. I got a wonderful job as an attending, which was so great. Finally, I had achieved this dream I'd been chasing for over a decade, and I remember seeing my first patient, went in, saw the patient, wrote the script, told the mom I would see them for their follow-up, the big boss, and came out of the room. And it was so anticlimactic because I remember going like, okay, so I just did this. I'm going to do this 20 times a day till I'm 70 and I'm not to do anything else. I was like, I know there's more. I have no clue what that is, but there has to be more, right? And so I started searching. I didn't know anything about any other options. My dad is, was a physician, and you just do what I just described. And so that started this itch that there's something else. And so I remember my boss telling me 9 months into my job, he says, here's a 5-year contract. I've really loved working with you. And I'm like, I just completed a 3-year residency. I'd been married for 3 years. So my definition of forever was 3 years, right? So I was like, wow, that's a really long time, but I'm going to need to move anyway. And he said, okay, so start your own private practice. I'm like, who starts a private practice like a year out of residency? This is not how that works. And in case you've missed this ginormous bump, I'm pregnant. Like this, we're not doing this. And he said, no, the baby will need you a lot in the beginning. The private practice will need you less. And when the baby needs you less, the private practice will need you more. This is actually the perfect time. If you have questions, ask me. And so I was like, okay. And so I decided, yeah, we're gonna start a private practice. And I will say ignorance is bliss because my philosophy was I will hang the shingle and they will come. And so I was like, great, we're gonna start practice, found a building, got all the things ready and hung the shingle. Only that they did not come. And I was
Yeah.
like, wait a minute. It then dawned on me for the first time that being a great clinician does not make you a great business person or a great private practice owner. They're two completely different skill sets. And so I fumbled around for quite a bit. I was like a deer caught in headlights. I was like, how can I if I could have gotten out of it, I would have gotten out of it. But I had, put my hands in too many things. And I remember reading a Brian Tracy book, Eat That Frog. And it said, all business skills are learnable. If someone looks like they're doing better than you, they're not doing better than you. They just know what you don't know. And
Yeah.
I will remember that for as long as I live. I was like, wait a minute. I was like, okay, I may not know how to run a business. I may not know to hire. I may not know how to build company culture. I may look at a profit and loss statement and break out in hives. But there's one thing I'm very good at. I'm very good at learning. I'm a whole physician. I have spent the last 10 years just learning and learning impossible things. And so that's when my love for entrepreneurship started. Whereas like everywhere my practice or my business where I see a problem is just an indication of a skill that I do not have, which I can acquire. And so that changed everything for me and, really started thriving in private practice, even though it's pediatrics and people say that's one of the lowest paying specialties, even though we had a lot of Medicaid patients, but we had a really good business sense. And so the practice worked. And then in 2016, I think that's when I came to this awareness that medicine as we know it is gone. Like the version of, hang the shingle and they will come, just do good medicine and everything else will follow. Like that's all gone. And if all I know how to do is see the patients, then I'm going to be out of luck, And so that's when I really started going even deeper and retooling myself, speaking, writing, authoring, helping other people build profitable private practices and all of those things. And that evolved into, EntreMD, where we help doctors build profitable businesses and a marketing company and on and on. But yeah, that's kind of how that happened.
Yeah, you said so many powerful things there. There's um, that old baseball movie, Field of Dreams, this idea of when you build it, they will come. I've always believed in business, it's when you build it, no one cares. And, you start to realize that. And I love what you pointed out about learning. I bark at people every once in a while when I hear this thing said. And what it is, doctors just aren't good business people. And I think that this thing is allowed to be said. You hear it from people in finance, you hear it, and it's wrong. It's just, that's not the thing they learned, because guess what? They know a whole lot more about the anatomy than you do, or, the structure or the process and our systems. So to say that someone is bad at something when they actually just haven't been given the same opportunity to learn the pieces of it is insane to me. And unfortunately, I think physicians start to tell themselves the same thing. Like you said, I forget what term you used, but the idea of looking at a P&L freaked you out a bit, right?
I would break out in hives. I'm just like,
Yeah, there you go.
don't want to
Right.
do it. Don't know what this is. Don't want to know. I can see patients all day. You take care of that.
And it's so we still see this, we like there are people that we work with, and we look at their income statement, and their income statement is set up wrong. It's got a single line of income, and then everything is an expense, and they can't make a decision based on it because it's just not set up right. So really powerful. I love the story. I'm curious, what kind of things do you hear from physicians that maybe were a little bit cynical before, and fast forwarding to after they've done the learning and after they're implementing, what kind of things do you hear from that person?
Man. So, like there are a lot of statements that would come up. For instance, I'm not a business person. And you just alluded to this, and that's just because we were never in that world. We were never taught. And there's this big transition because there used to be a time where physicians had monopoly, not because they lobbied for it or anything like that, but a private practice would be owned by a physician. There were not other players. Like when I was a resident, I never thought CVS would be my competition. You know what I mean? Like,
Right. Yep.
so because of that, you could hang your shingle and they would come because there's not that many options.
Yep.
But now it's so many more players in the pie. You have to figure this stuff out. And so now I have a lot of clients who say, oh, I'm a great clinician and I'm a savvy entrepreneur. They embody both. And that is just so magical when you can see a person who is running a private practice and they have the patient care down pack and they have the business down pack. That makes for a sustainable, healthy practice that creates a true win-win-win, a win for the patient, a win for the team, right? Because they don't have to be let go, a win for the business itself, a win for the community, a win for the owner, which is just so good. Some other people will say, I hate business. Business destroyed medicine. And I'm like, okay. So business is not good or bad. It just is,
Mhm.
right? And so business run by people who put profits before people destroyed medicine or attempting to destroy medicine. But when you can see doctors who then understand that that what they do as a business owner, what they do as a private practice owner could be the thing that saves healthcare. That's such a noble thing, that the healthcare space is in such a crisis that they actually need you to be a great entrepreneur, right? And so they embody that identity. They're no longer ashamed of it. The other piece is so much drama around money, right? Like, I don't want to talk about the profitability of my practice because it's not about the money, it's about the patient. And, I don't want to be greedy. Like, how much is too much? Like, the patients I'm serving, I have more than them anyway. And there's just all of this stuff. And I'm like, okay, like, time out, right? Because the deal here is if your practice is profitable, you then earn the right to continue to provide great clinical care.
Yes.
And so one of the best things you can do for your patients is run a profitable practice because they lose a great doctor if your practice is not profitable and you have to shut down, right? And so now you have doctors on the other side who are not ashamed of profit, who don't feel guilty, because it's so much guilt, don't feel guilty for going after building a profitable a profitable practice. They own
Yep.
the numbers and they're okay with it. They're okay to talk about their numbers. Like, oh my goodness, you won't believe it. I had my first 7-figure year. I had my first $2.5 million year. And they're talking about this in community. And everybody's cheering them on, not people saying, oh my goodness, ew. Like, we're not in it for the money, right? Like, and so it's so beautiful. It's so beautiful to see that. And I think one of the other things is, I don't know if this has been your experience, but I find a lot of private practice owners shy away from leading their team. They will not have team meetings. They will not cast vision. They will not hold anybody accountable. And even the biller can do whatever they want, as long as whatever you did is enough to pay the bills and pay the team. We don't have to have a conversation. And to see doctors having, like, embracing their role as leaders,
Yeah.
casting vision, this is where we're going, having quarterly team meetings for their team members, having difficult conversation when things are not work. Like, for instance, your AR is out of whack and your biller says it's okay. I had a client says, it's okay, like everything is good. No, I want to see the reports. I'm telling you, everything is good. I want to see the reports. No doctor has ever asked me about this before. And she's like, well, I'm an entre MD. I'm asking you, like, we need to sit down and look at the actual numbers. And so to see a doctor, okay, understanding accounts receivable, understanding profit and loss, being able to make data-driven decisions is a thing of beauty. And the thing is this, I tell doctors, we learn the Krebs cycle. Some people replace hearts, intubate, 2-pound babies and all of that. If you could learn that, you can learn, you can learn all of this. We just have to see enough examples of what is possible. Like, we can do this, we can evolve. We're not like a rock, we're more like Play-Doh, right? Like, so we can evolve. We can become something we're not right now. We can become savvy at something we don't know anything about right now.
Yeah, completely agree. The philosophy that is the foundation for the Physician Growth Accelerator is that everything we experience all the time is a perfect outcome of our current system. And you said something that really resonated with me. It's not, business isn't good, it's not bad, it just is. That's really everything, right? It's things either work for you or they don't work for you, but they are just, it is what it is. And it's up to us to tweak the system if we want something different, and taking that responsibility. You mentioned leadership is something that comes up a lot. And I think there is, again, it's similar to being kind of afraid of the P&L. They haven't set up the foundation where they feel that it's appropriate for them to hold people accountable. And they let things go too long. So then it's a blow up moment. And now they feel bad about the blow up moment. And now they can recreate this cycle of a low accountability practice, which is not good for anyone. There is no happy person in a low accountability business. I don't care what business you're in. And it's just, the things you mentioned are just so powerful. And the AR thing is bigger than even you talk about, because unfortunately, I know probably a dozen practices who have found out after years that employees were stealing from them. And if there's someone in finance who doesn't want to run a report, or they never want to take a vacation, let me tell you, there is some digging to do, because it is insane what we've uncovered over the years. I don't know if you've come across that when people going through your process.
I've come across a lot of very interesting things.
Yeah.
A lot of interesting things. People paying themselves a nice 6-figure salary, other than whatever they're being paid, just from what they're able to, take from the practice. And, you know, what I tell, physicians is, your billing departments, in-house, outsource, whatever, is like your aorta, like, it's the biggest blood vessel, like, right next to your heart. And if
I
it
love
gets
that.
nicked, you bleed out, the end. Like, and so the same way, like, if I'm an ICU doc, I always have my eyes on the monitor. Like, what's the heart rate? What's the respiratory rate? What's the oxygen saturation? Like, I'm looking at that in real time. I'm not looking at it once a day. I'm not looking at it once in a while. is the same way that billing department, it's so critical. Like those are your vital signs. You kind of need to look at it. Um, but because it's not something we necessarily, for the most part, understand coming out of training, in the area where there's ignorance, we just avoid it. And so what pacifies us is that, well, we're still making payroll. We're still getting some profit, but what if it could be 10 times the profit? Like you don't know, right? And so it's just so critical. It's something we have to become competent at looking at, and not just a number, but also understanding the story it tells. Like I'm looking at these numbers, but what does it mean? What is it telling me? What is it telling me about, people not paying co-pays and stuff before they come into the office? What is it telling me about maybe my biller is not being on top of these and sending this out in a timely way? What is it like? What is the story? So you can make data-driven decisions. Yeah. So we don't have a choice. We do need to it's part of the game. We do need to master it.
Yeah. And, you mentioned that profitability, sometimes people think about it as bad or evil. And you mentioned it, and I just want to put a little exclamation point on it. But as a physician, your patients are under the care and protection of you in some form. And if you were to paint two scenarios, and one scenario is you've got this castle with, wood fences, no moat, and anybody can come tackle it. Are the people in that castle really under your care and protection compared to a castle that's got a gigantic moat, huge walls, massive defenses? To me, a healthy business, you're truly able to give that care and protection, because now your focus can be there as opposed to always being in danger. And that business health is what allows you to provide care to patients. I think when people treat the business as evil, it's really self-protection because they don't understand it, so they have to call it evil. I'm a big fan of this idea that if something is not life-threatening, it can only be ego-threatening. So if you're responding in a way as if something is threatening your life, maybe dig in a little bit and see where is your ego getting the hammer to find out where that response is coming from. Not sure if that rings true for what you've seen or not.
Yeah, it does. And I'll throw this out there because I think we do that also because of privilege. And privilege, and we've been shielded. Like so. A doc who's working in the hospital, this is what life looks like, right? They leave home, they go to work, they stop to get their coffee, park in the parking lot, get into the office, put on their coat, put away their stuff. And the nurse walks in and says, room number 1 is ready for you. They go see the patient, they do the script, they go back. They do this a few times a day, they go home. And they do it over and over and over. And after 2 weeks, money magically shows up in their bank account. And so it gives us this false sense that we can take care of the patients and the money will take care of itself.
Yeah,
Because
that's really
that's
great.
the experience we've always had. And so I think of when I worked in a hospital setting, or I worked in the beginning of working in a private practice, I was clueless as to how much money they have to collect up front. I didn't know what a deductible was, right? Like, so there's the copay, there's deductible. There are people that the hospital hires out to go do marketing. There's physician liaisons. There's a collection department. There's a billing department. We are completely oblivious of all of this.
Yeah.
And so then we have this thing of, yeah, I just do good medicine. And because people like me, they keep coming. And that's how we make money. Right. And so you hear them say things like, this is how much I generated for the practice. And this is the only thing they paid me. I'm like, yeah, because it's a team effort. And there's all these other players that you don't know about doing these things. And so I think we truly don't get that they're connected. So when people start practices, they try to do the same thing. So I don't know if you've had this experience, but many people are like, I don't want anything to do with marketing. I don't want anything to do with this. I want to hire an office manager who lead the team. I just want to see the patients. I'm like, you need a job.
Yeah.
Because this is going to be very ugly and this is going to hurt a lot. Like if you are open to say, okay, let me explore, let me see how I can evolve to be the kind of person who can run this kind of practice that I want to run, then that's okay, right? We can learn, we can always adapt. But if your mindset is like, I don't want anything to do with all of that, I just want to see patients, you need a job. You need
Yeah.
to shut the practice immediately and get a job.
You know, it's funny. You just made me think of a scenario that is probably an example of also things that come from this. I only want to see patients. I hire an office manager, and then you don't actually give the office manager the full autonomy to run the business. And so the office manager puts things in place, and then the kids get to run to the doctor and go, you know, mommy told me no, but will you tell me yes? Well, yeah, sure, that's okay. And that's just, you're setting yourself up for big time headaches going forward.
Oh man, you just unearthed a whole other thing that we probably need two podcast episodes for. But um because that is the just like you described, that's a disaster. And the thing is, when you don't even know, like, you hire an office manager, the office manager is still going to need some direction from you, not task level direction, but at least outcome level direction. Like, what is this? What are their KPIs? What are the top
Yeah.
outcomes they're responsible for? What are you holding them accountable to? Because if that person is a champion level team member, they're going to look for vision. They're going to look for direction. They're going to look for accountability. And if you don't know, you can't lead them. And if it's an A player, they won't stay, which is bad. If they're a C player, D player, they will stay, which
Which
is
is
bad.
worse.
You know what I mean? Which is worse, right?
Yeah.
And so your leadership is required. You need to know, you need to be in the know. My next favorite thing, right next to your example, is people like, I don't want to know anything. Like, I'm just going to see the patient, so I'm going to hire this marketing team, and they're going to figure everything out. But the marketing team, you're not able to lead them. You can't tell them, this is a voice of the practice. This is what we stand for. These are our ideal people. And you don't know if they're doing a good job or not, because you don't know anything about it. So they can give you any kind of bogus report and show you some really cute graphics on social media and tell you we're doing everything, but you can't even call it out because you don't know what a good job looks like. Right.
Right.
And so at the end of the day, if we're going to run practices, our evolution is required. And once we make the decision, I will do what it takes, it becomes easier. It's not as difficult as we think it will be when we're in resistance. Because once we're in resistance, it's like all this, I don't want to think about it. I don't want to do anything about it. Don't tell me about it. I'm not, once we accept, like, okay, let me learn this thing. We've learned harder things. We've learned hard things, at least. We can do this too, you know? But that office manager thing, that was so good.
You feel bad for them. Well, it's you know, the foundation behind us is an understanding of neuroscience and human behavior. And if you go back 100,000 years, the brain is basically the same as it is today. And if you imagine what were threats then, those things don't exist anymore, but the biases and heuristics that were built from those threats do exist. And so if you have an A+ leader coming into your practice and you don't give them vision and you don't give them KPI, you're actually setting off biases that make them feel like they are in danger staying in your organization. And the people who are the C and D players, you're firing off biases with them where they actually feel leaving the organization is dangerous. And that's why I'm such a fan of everything we experience is a perfect outcome of our current system, because we shouldn't be surprised by these things. You've set up a system to achieve that outcome. If that was your goal, sweet. If your goal is different, then let's tweak the system.
I like the way you put that. It makes it sound like even more of a problem, which is a good reflection of what the problem is, because that is a huge problem, big problem.
Yeah. Well, Dr. Una, I really appreciate you spending time with us today. I agree so much with your philosophy and what you're doing. And I know you're also an author, which is, I really appreciate. I like to say this to authors because I believe books are cheat codes. I love the fact that I am able to consume someone else's wisdom and experience in a few hours that took them years, decades, and more to create. So I appreciate the fact that you have authored books. Can you tell us about your most recent book?
Yeah, and thank you for saying that. So my most recent book is called The Profitable Private Practice Playbook. And the reason I wrote it is because of the number of closures of private practices that I started noticing. So I started noticing it early in my career, but I'd hear about one or two. And then it started getting this experience where in, private practice Facebook groups, it was like almost every other day. Someone's like, man, I've had it, I'm going to shut down my practice. And then I looked at, I was reading an article. It said that 11,000 private practices shut down in 2021, either shut down or sold to private equity. 11,000 in 1 year. And it made me go like, okay, hang on. How many years can we do? There's a million physicians. Like how many years can we sustain
Yes.
that for? Right. And then, while I was writing the book, and I'll come back to the book, while I was writing it, I read another article about, Walmart, like we're going to shut down 51 clinics in Florida. And I'm thinking 51 clinics. I'm like, okay, let's say they had itty bitty panels and they all had 1,000 patients each. That's 51,000 humans who have been displaced from their medical homes, if you will.
Yep.
And I was like, one of the best things we can do for healthcare is figure out how to help private practices thrive. And so I started thinking, I was like, it's not clinical care. This is not why private practice is shut down. It's almost always, financial and stuff like that. So I said, yes, we have issues with, decreasing reimbursements and all of that. But the recommendation, if you're on a plane and the oxygen level is low, is that you put the mask on yourself first. And then, you can take care of everyone else. And I was like, we have to take care of ourselves first. And then we can go on an empowered front to address insurance issues and all of that. So I said, what are the top 7 ways private practice owners leave money on the table every single day? What are those? And I looked into them. I'm like, what are the fixes? I looked into them. I'm like, great. Here's here. I went, taught a workshop. I'm like, these are the 7 ways you're leaving money on the table. This is how to fix it. We had about 800 people register for the workshop and start creating transitions in real time, right? I did surveys. I'm like, how many of your schedules are full 80% of the time? 40%. 40%. I'm like, what? And then I said, okay, how many of you are collecting copays at the time of service? 50%. And I'm like, what? Like, so there's so much left on the table, not collecting pay. How many of you look at your AR and you look at your AR? 40%. They're not even looking at it, talk less of making data-driven decisions. And so the book is very simple. It's not complicated. You don't even need a very deep understanding of business to understand it. It's literally a playbook. Every doctor who owns a private practice can get a copy for his office manager and say, okay, we have these 7 leaks in our business. We are going to plug these 7 leaks. In this book, I did a case study with a fictitious, and not a real doc, like Dr. Ebony. She's a pediatrician, solo pediatrician. She was able to recoup over $800,000 in her business just applying this because she made all 7 mistakes, right? And this is a pediatrician, okay? So just take it, install it in your business, like 7 leaks, plug the leaks, and then go do more complicated things, right? But it's a book that I literally think every private practice owner and their office managers should have, so that they can bring financial stability to their businesses. It's 124 pages, really easy read. There's no fluff. It's like, this is the issue. We start off by addressing the 7 mindsets that keep us broke, though, because, we have to get all those weeds out of there first. Not broke, but, like make our practices suffer.
Mentally broke. Yeah.
Yeah. Mentally broke. Yes. And so it's called the Profitable Private Practice Playbook. And you can go to our website, entremd.com/private practice book, to grab a copy. I can almost guarantee that it will be the best $15 you spend for your practice.
I love it. I love it. I'll make sure that we have a direct link to that in the show notes for easy access for everyone. You doing that survey, I had, just from things that we've witnessed, I would bet the people who only had the 40% of the people who had less than 80% capacity filled were probably also thinking about hiring providers and adding locations.
Yes. Yeah, you see, you and I need to do coffee after this because we're speaking the exact same language. They're the
Yeah.
ones who will want an office manager. They will want, two extra nurse practitioners. They will want to hire a marketing
Yep.
team that will pay. They will pay $10,000 a month. They want to do everything but evolve.
Yep.
As long as I don't have to look at the AR, I don't have to do any marketing. I don't have to lead my team. I will pay whatever. Yeah, it's an amazing thing to see. So thank you for calling that out.
Yeah. Well, I'm excited. I'm excited for our listeners to get a copy of that book, and I really appreciate you taking the time with us today.
Thank you so much for having me. And again, thank you so, so, so much for what you do because healthcare is in the middle of a big crisis, and private practice, the health of private practices is the health of America. So this is some really serious work. Thank you.
I appreciate that. And our listeners, we'll see you next time on the Physician Growth Accelerator.